Thomas, I want you to help us with the great fear, which is the incubation. We produce cytokines, and then we have the prodrome, which is fever, malaise, aches, pains, and nausea, and that can vary virus to virus. Are we any smarter this morning in Geneva about the prodrome of the incubation than we were a week ago?
Well, the incubation period, it's really important here because they've determined that it can take about 2 weeks for the virus to incubate and then show symptoms, which, that raises questions to all the numbers that we've been getting of reported cases. So far, it's 2,700 reported cases, but will that number start ballooning given this delay? That's the big question.
It's a fancy name, coronavirus. There's Ebola virus, polio virus, which we all lived with in our youth. I was right on the back end of that fear, folks. Norovirus as well. What kind of virus is this coronavirus? Is it comparable to something?
Well, it's, they're all viral diseases. This one is very much comparable. There's one study saying it's something like about 70% similar to the SARS virus, the genetic components. But doctors are still trying to assess this entirely, and it does seem to have the rate of fatalities seems to be different than the SARS case.
Thomas, how long does it take for a company or for healthcare companies to actually come up with a virus against this? Sorry, an antidote, a vaccine?
Yeah, well, companies are already trying the best that they can. What's being used right now in Chinese hospitals is an antiviral AIDS treatment, actually 2 treatments that are made by AbbVie. They're trying to use that to treat patients. Another thing that's going on is Gilead is testing whether or not an Ebola treatment that it has could be revamped for use against this.
Okay, do we know what the next step is? We also know that actually China is building big hospitals. In Wuhan, there's a hospital that, with 1,000 beds that they're erecting at the moment that should be done by February 3rd. Do we know what other steps could actually help with this?
Well, it's a matter of research, and it's a race against the clock to find something that could treat this virus effectively. Another thing that just happened is the Bill and Melinda Gates Foundation offered $10 million to help the first treatments against this in China and in Africa. But it's early days. There's no effective treatment yet, so we need to see what can be done there.